Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio. We're going to be speaking with Eduardo Dunayevich. He's joining us here as Vice President, Franchise Leader, and Clinical Business Development Leader for Neurocrine Biosciences. He's going to talk about involuntary movement disorder called Tardive Dyskinesia, or TD, which is associated with prolonged use of certain mental health medications. They're used to treat depression, bipolar disorder, schizophrenia, and more. Thank you so much for joining us, Eduardo.
Thank you, Neil, for having me.
Tell us a bit about your background.
Certainly. I am a psychiatrist. I trained at the University of Cincinnati, Ohio, and I went to medical school back in Argentina. And I've always found biology and behavior really fascinating. And as a matter of fact, in medical school, I was a teaching assistant in physiology and neurophysiology, and I was really very excited about the complexity of the brain and all that there is to know about it. And on top of that, mental illnesses are extremely common. They can be highly disabling, and they routinely go under-recognized and undertreated. As you know, according to the National Institute of Mental Health, about 1 in 5 Americans lives with a mental illness. So choosing psychiatry for me was a natural way to bring together my interests in the service of an area where there is a major unmet medical need.
What is tardive dyskinesia?
Yes, tardive dyskinesia literally means delayed abnormal movement. Tardive dyskinesia is associated with the use of certain agents called dopamine receptor blocking agents or antipsychotics. Usually it's required that somebody be exposed to these dopamine receptor blocking agents or DRBAs for at least 3 months, and oftentimes much longer than that, several years. So that's what the delay in the development of the abnormal movement is, which is that you have to have extended exposure to the offending agent. Now, how does tardive dyskinesia manifest? Well, these movements can be rapid and jerky, or they can be actually slow and writhing. They can be present in any part of the body, but most commonly they're present in the mouth and face, and they can show up as lip smacking, puckering or pursing of the lips. It can show up as dancing or darting of the tongue, blinking, chewing, side-to-side or clenching face movements. You can see it in the hands or toes, as twisting or dancing of fingers and toes. In the more severe cases, it can show up as twisting or stretching of the neck, the trunk, and limbs. And this can be actually quite painful and disabling. In the United States, it's estimated about 600,000 people live with tardive dyskinesia, and about 70% of them have not been diagnosed with this disorder.
Will everyone who takes antipsychotic drugs develop TD?
No, fortunately not everybody develops TD, but there are some risk factors for developing tardive dyskinesia. Mm-hmm. It more commonly occurs with extended treatment with these dopamine receptor blocking or antipsychotic agents. And one of the main risk factors is being over 45 years old. It's also been suggested that people who have other conditions such as diabetes may also be at increased risk of tardive dyskinesia, as well as those who had movement disorders early in the treatment with antipsychotics.
Why do you think that awareness about tardive dyskinesia is so important, especially now?
Well, a couple of reasons, Neil. The use of antipsychotics is actually quite common. In the United States, between 1 and 2% of the adult population is receiving these DRBAs or antipsychotic agents. So if you think about it, right, out of an adult population of 300 million people, that would be about 3 to 6 million people who are being exposed to these agents, right? And tardive dyskinesia can be actually quite disabling. In the more severe cases, can be associated, for example, with difficulty conducting everyday activities. Mm-hmm. People may have difficulty, for example, buttoning their clothes or being able to feed themselves. The jerking movements can be actually quite painful. But even in the less severe cases, it can be associated with a sense of shame because the patients may feel that the underlying medical condition, the underlying psychiatric condition may be apparent, or they may feel like they're going to be singled out because of these abnormal movements. And therefore, screening is critical, again, because of the under-recognition, but also because it's important for the healthcare provider and the person who is experiencing tardive dyskinesia to have a dialogue about what these movements mean to them, how disturbing they are, because the stress associated with the movements may be entirely subjective and associated with the shame and discomfort that the person experiences.
Are there any instances of a misdiagnosis? What should someone do if they suspect that they may have TD or they're having some of these movements and it possibly is not tardive dyskinesia?
Absolutely. There's quite a bit of concern about the potential that these movements may be misdiagnosed. What's really critical for anybody who either suspects that they or a loved one has tardive dyskinesia would be to speak to the healthcare provider about these movements and discuss the possibility that they may be, a product of any medications that they may be taking, have a conversation, and if the healthcare provider is not comfortable with diagnosing and assessing for these movements, that the patient be referred to somebody who has expertise in this area.
Well, just
keep in mind.
Go ahead. Keep in mind.
Sorry.
No, keep in mind.
Keep in mind that the majority of folks who experience tardive dyskinesia have not been diagnosed, and therefore the need for increased awareness and recognition of the disorder is really critical.
What are some of the go-to treatment options for TD, and then tell us where our listeners can learn more?
Fortunately, there's a class of medications that has been approved for the treatment of tardive dyskinesia. They're called the vesicular monoamine transporter type 2 inhibitors, or VMAT2 inhibitors. For those who are more interested to learn about these treatments, the FDA-approved treatments, there are a number of resources that they can consider checking into. There's a couple of websites, for example, for healthcare providers. There's a website called mind-td.com. That's mind-td.com. And for the lay public, there's a website called talkabouttd.com. Both websites have more information about TD and the available treatments.
And where might we find more information about Neurocrine Biosciences?
Information about Neurocrine Biosciences can be found at Neurocrine's website, neurocrine.com. Neurocrine is a company that is focused on the development of treatment for neurological and psychiatric disorders, as well as endocrine conditions. And it's focused on really finding novel treatments for people who have great needs but inadequate treatment options.
And that's spelled NEUROCRINE.com, correct, Eduardo?
That's right, Neil. Thank you.
It's been a pleasure speaking with you. I'm hoping that you'll return and give us some updates as things progress there at Neurocrine. Thank you so much for your time here on Health Professional Radio.
Neil, it has been a pleasure. I'm glad that I had a chance to come and talk to you about mental illness, TD, and the need to recognize the potential for its presence and its need for treatment. Thank you so much.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Eduardo Dunayevich. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. Be sure and subscribe to our YouTube channel at youtube.com. You can also find us at Anchor Spotify.